The COVID-19 coronavirus crisis has now become a real war as NGOs, governments and private institutions have put to use massive resources to address it. What appeared to be a minor health problem in Wuhan, China just a few months ago has now turned into a global pandemic affecting every aspect of our lives. Healthcare services have been challenged and livelihoods have been destroyed. According to the World Bank, global poverty is expected to increase to 8.6% for the first time in the last 20 years. While even the most advanced economies, which are currently most affected by the COVID-19 virus, are going to contract, the poorest countries, especially in Africa where the virus has still not widespread, are going to be economically most affected. Deterioration in health and economy leads to other social problems like inequality, discrimination, conflict, crime, lower education, violation of human rights and disorder. NGOs are now required to play an even greater role in addressing the various effects arising out of the COVID-19 crisis. Donors are actively searching for partnerships with NGOs to work together. In this article, we discuss the ideas for partnerships for NGOs with donors and what types of projects can be proposed to receive funding. Emergency health preparedness. As health is the primary area that has been severely affected by the coronavirus, the first priority of donor funding has been to provide emergency relief to health workers fighting to save lives. The Bill and Melinda Gates Foundation, along with Wellcome and MasterCard, announced one of the early grants for identifying, assessing, developing, and scaling up treatments against the epidemic. Research. As the epidemic has been caused by a new type of virus, research has been an important element of international funding as many questions related to its unprecedented spread, treatment and its long-term effects on an individual's health are yet to be answered. Countering fake news. As the impact of COVID-19 spreads across countries and societies, NGOs would be required to assess and propose projects to address the social and economic challenges of the epidemic. For example, the outbreak of the virus has caused an uncontrolled emergence of fake news regarding its spread and treatment. Across the internet websites and various social media channels, various myths are being propagated such as, using pepper in soup is going to cure COVID-19, houseflies spreading the infection, 5G mobile networks are responsible for the spread of the diseases. Human rights. The spread of the virus has affected certain vulnerable groups such as the LGBTQI community, minorities and the poor as they have been subjected to negligence, hate speech and boycott. It is for the human rights-based NGOs to take the lead to check the propagation of hatred against the vulnerable populations. They can develop proposals that seek to protect the rights of these marginalized people, especially when the governments are busy addressing the wider problems. Women, girls and children. Women, girls and children can be at the receiving end of the pandemic as there can be a rise in the sexual corruption, sextortion, child abuse, domestic violence, gender discrimination and violation of basic rights due to public restrictions imposed by governments. According to a World Bank report released on the 7th of April 2020, violence against women tends to increase during every type of emergency, including epidemics. Older women and women with disabilities are likely to have additional risks and needs. Women who are displaced, refugees, and living in conflict-affected areas are particularly vulnerable. Livelihoods. Governments and banks in many countries are coming forward to provide loans and grants to small businesses to help them revive the economy and improve employment levels. However, millions of subsistence farmers and rural enterprises have also lost crucial livelihoods and require immediate relief support. NGOs can propose projects on building their livelihoods, maintaining supply chains, arrange access to capital and loans and improve their living conditions.